Do calcium supplements cause heart attacks and clog arteries? If you do have to take calcium, how do you supplement? Especially if you're a woman over 50 and your OBGYN says you need 1,000 milligrams a day and you're thinking, how in the world am I going to do this? Well, we're going to tackle these questions today and so much more. It's all about calcium. I'm Kym McNicholas with the Global PAD Association. This is Ask NP Deidre, and we have Deidre Arms. She is with Aspire Integrative Wellness Integrative. How come I always mess that up? Aspire Wellness and Integrative Health. Make sure you go to aspirewih.com if you're in Ohio and you want to inquire on her services. She is the most amazing functional medicine practitioner and NP, especially for women. So I've been wanting to do this topic forever,
I know
Deidre.
you have. We've kind of got derailed a few times because of other requests. So
Yeah.
we're finally here, finally going to talk about it. And
And
so,
this one's personal because my OBGYN, I turned 50 in September, dear Lord. And she said I needed 1,000 milligrams of calcium a day. And I'm thinking, how can I do that when I'm anaphylactic to dairy? There's just, I just don't understand. I could be eating spinach for days. And don't even get me started on sardines. I'm just kidding. We'll get into that in just a moment. But what are your initial thoughts?
so my initial thoughts is we often can get enough calcium through the diet. One of the things that I like to look at is the comprehensive metabolic panel. So you can draw a
Okay.
calcium level there and see where you fall from your dietary supplementation. I know that, everyone tells you take calcium for your bones, right? But then you hear that it might harden your arteries or increase your risk for
Right.
heart attack risk. And so then there's this, well, what do I do? Do I take care of my bones? Do I take care of my heart? And so really trying to break down those truths for people and what the science says, how can you take it safely, especially if you already have PAD or any cardiovascular health risk.
So, what is the truth? We always talk about the gut and that what you eat literally can go right into your arteries. And so, why would you think it's any different when it comes to supplementation of calcium or consuming foods that have a lot of calcium in it? You'd be worried, oh my gosh, am I going to get more calcium or atherosclerosis in my arteries and worsen my symptoms for PAD in the legs or coronary artery disease?
Yeah, and so some things to think about is 99% of our calcium is stored in our bones and in our teeth, and only about 1% of calcium circulates in the blood. But that 1% is really critical, right? It helps with muscle contraction, it helps with nervous signaling, it helps with heart rhythm. So we know we need calcium for those things. But like you said, it's personal, like after age 50, and especially when women stop cycling and they're postmenopausal, as estrogen declines, we start to see that increase in bone breakdown. And that bone loss can accelerate, and then we get those risks for osteoporosis. And so that's why your GYN's like, hey, you need to be taking this because that's a recommendation based on age and estrogen decline. So there's so much nuances we need to know before we say just blanket take that, right? We want to
Right.
know vascular risk. We want to know what their estrogen levels are. And so, you know, that just blanket statement comes from the National Osteoporosis Foundation, where they recommend women over 50 taking 1,200 milligrams a day of calcium. But I always start with like checking that lab. Are you getting enough calcium in your diet already? Like, are you already that person who's getting plenty?
Okay, that's a really good tip. I didn't know to do that. So the next time I do go see her, when I have to go get the blood work, as you do every single year, might as well add that to the list. What about D vitamins, though? I was hearing that when you take a D3 M2, what is it, M2, K2,
Yeah.
MK7, right?
Mhm.
That helps with your bones.
Right, it does. So, and that's something that when we're looking at And especially women, not saying men don't get osteoporosis, but it's a predominantly female, disease where as estrogen declines, we have that risk factor. And men have more testosterone, and testosterone helps with bone turnover as well. But when it comes to vitamin D, it helps that absorption, especially when you're adding the K2 into that, because it's like calcium needs a traffic director. It needs vitamin D to help the absorption of it. It needs K2 to basically direct the calcium to go into the bones and not into the arteries. That's why the K2 is so important. And then it needs magnesium to kind of balance the calcium signaling. So you're right that minoquinone, the K2, that's shown to reduce vascular calcification, progression, and improve arterial elasticity, is superior for people with PAD.
I've been doing yours since you told us last time, the D3, K2, MK7, along with the magnesium every single night, but I don't take a calcium supplement. Is that something that you often do prescribe for your patients? I know you said that we should get the calcium blood marker test first, but what is the indication for taking a calcium supplement?
So if I had somebody with low calcium levels on a CMP, they weren't getting enough dietary, and they had osteopenia porosis, yes, definitely. I would first look at their food as medicine, right? We have the opportunity to increase food. I will always start with vitamin D though, because I live in Ohio. We have maybe 75 sunny days a year, maybe. I think that's what it is told. And so vitamin D deficiency is huge in this part of the country. And so optimizing vitamin D so we can pull the calcium. So that's where I start with people. And then we start to work on getting it in through the diet. We don't want to get over 2,000 milligrams of calcium a day. We really want to aim for that 1,000 to 1,200 milligrams a day. And that includes your intake of food and supplementing. So, that's why I'm saying we have this opportunity to like add it in with food first and then be supplementing with vitamin D. So I will tell you, it's not my go-to supplement. It's not something I prescribe or recommend all of the time just based on a blanket statement. It's very individual, and I try to get food as medicine first into my patients.
Okay, but it is a discussion that you think that the patient should have if they are prescribed calcium. How much of that calcium could end up in their arteries? Is that fair or is that fallacy?
No, that's a fair thing because if you're supplementing and you're not getting vitamin D, you don't have the K2 to push it into the bone, well, then where is it going to go, right? So it can go into the artery, but when you're intaking it through food, that is when we have the biggest opportunity to, food is medicine. That's the biggest opportunity to be the most friendly to our body. And when we think of artery-friendly calcium foods, that's your leafy greens, right? Your kale, your collard greens, your bok choy, almonds, sesame seed, tahini. So there's so many things, we always thought dairy, like have dairy, but we have so many patients that have issues with lactose and dairy, and that's one of the top 5 inflammatory foods. So we see a trend of more people not taking dairy in their diets.
Okay, so let's go through those foods. You just kind of ran right through them. There are a lot. I'm trying to take notes over here. And then I'd like to figure out a little bit of a meal plan, how I could add it, because a lot of times I do intermittent fasting. I don't even, for the most part, have breakfast. I'll do a smoothie maybe once or twice a week, and then I have some eggs with veggies mixed in as my breakfast on Saturdays and Sundays. That's about it. So I wonder on the other days during the week how I'm going to get enough calcium in because I'm only eating 2 meals a day.
Right. And so that's where you look at sometimes it's important for us to take a week of our life, just a normal week, and track what we're eating. Not only for the calcium piece of it, but looking at like how much protein are you intaking, how much fiber are you intaking. And this way you would know, because supplementing is meant to supplement your diet, meaning not every day do you need to take that calcium pill when you're eating 3 meals and you've got enough calcium intake. But in order to look at that, we have to kind of track for about a week, because I say everybody in 2 days will do a perfect diet, right? You'll always get the best diet when you have people
Yeah.
track for 2 days. By day 4, they're going to be adding things in, or they're not going to be eating. And if you do a 7-day diet, you're going to really see real life, right? At some point in that 7 days, they will have eaten a meal or two that isn't their normal or isn't optimal. And then we have the opportunity to kind of break that down and say, it's looking like most days you're getting the 1,000 milligrams of your calcium in, but we have an opportunity on days when your diet looks more like this to maybe you're getting some in, but maybe you need an additional 500, because the total should be 1,200.
It just seems like a lot. So, and I don't eat
It is.
sardines.
Yeah, and sardines, that was one of the highest that I was looking at. Sardines and salmon with bones, it said. So the canned sardine and canned salmon packed about 350 milligrams
My
in
God.
just a can of that. I know, I
You
thought it
have
was
to
kind of
eat the
crazy.
bones, right? But sardines, you do eat the bones. But in
Uh-huh.
salmon, a canned salmon, even, you don't really eat the bones. At least I try not to. I choke on them.
Yeah. So I usually always spit the bone out if I
I
get it.
do. Yeah.
So now I'm like, oh, maybe I should just swallow it and not think about it. So,
So there was the influencer that you ended up sharing with me. I think it was on Instagram, Lil Slipper, I think her name is, and she
yeah.
does one or two things. And she made some sort of calcium rich pudding using egg and the eggshell. So she ground up the eggshell and added the chocolate to the egg. Like she cooked the egg or something like that, then added the chocolate and then blended them all together. It had the bones, it had or the shell, it had the egg inside, and it had the chocolate. And she said it supposedly tasted good. But I was fearing eating the shell of an egg. I would imagine you have to really scrub it really well.
Yeah, I would say that you would have to, and especially if you're somebody getting, farm fresh eggs, they're really cleaning those.
I
So,
wonder if you could clean them and then put them in a spice grinder and then put them in a salt shaker. And then there's just sprinkle it on your salad or sprinkle it on your food.
mm. If you try that, I want to know what that tastes like. I just doesn't sound very good to me, but it probably is good for us. I don't know.
I don't know either. I don't even know if you taste it, but there were a couple different things that people had said that to dry something out and put it in a salt shaker. So I thought, well, why not eggshells?
Oh,
I mean, if I have to get that much calcium per day, holy cow.
yeah, yeah. You know
Literally without the cow.
the collard greens without the cow, yeah. That's about 250 to 300 milligrams there of calcium. So if you're looking at like, how do I fit this in? I know that you like big green leafy salad,
Mhm.
so kale and collard greens added into that
Okay.
can be really good. Those are highly absorbable where, um, you know, we always think spinach, but those foods are more low oxalate, so you have better absorption than you do spinach for that. And then we
Oh,
talked about the fish. Tofu, that was another one for which is plant-based. So really speaking to people who tend to stay more plant-based, because the more plant-based you are, the harder it is to get calcium and amino acids and
mm.
things of that sort. So um, chia
So
seed, one of your favorite.
chia seeds. I love chia
I knew
seeds.
it. Yeah.
So I use chia. That's one of the things that I actually do have in a salt shaker, and I do sprinkle because I put it on everything. I love my chia seeds, but I
Yeah.
grind them. I do put them in a spice grinder, and I grind them up, and
And do
easier to
you
digest.
put them on everything then that way?
Everything.
Nice.
Yep.
Yeah.
Everything.
Nice.
Because you don't, I mean, they just kind of melt right in once they get a little moistened, and they don't have flavor. I mean, I don't taste them. So I sprinkle them on my salads. I sprinkle it on, just random dinner. If I'm having spaghetti, I'll sprinkle it on there. Um, I
And
know, so weird. So weird.
um, the fortified non-dairy milks, you can look at those and see on the label
Right.
how much dairy, or not dairy, but calcium is in that. So
Yeah.
those are kind of some simple ways.
And there's
We
even
always,
fortified orange juice, right?
mhm, with calcium. And so just always reading your labels, kind of knowing what the food is you're putting in, but tracking for a week. If you track for a week, like once a quarter, you're going to know where you need to reset things with your
Yeah.
diet completely, and just so you're getting everything and optimizing what your body needs. I think that's really important.
I'm wondering if basil has calcium because it's a dark leafy green, right?
Oh, so I didn't look at that one, and maybe it does, but I'm wondering if it's because we don't eat like cups of it at a time. Would
It
be why.
says 9 milligrams per 2 tablespoons. That's not very much. If I'm trying to get in 1,000 milligrams, 9 milligrams is not going to do me
Yeah, you're gonna really
any
be
good.
eating quite a bit of that, aren't you?
I love pesto. We just got back from Italy. So we just learned how to make pesto from scratch. And we got a mortar and we got a little pestle. And I got the basil plant. So tomorrow I'm going to be picking off the basil leaves, pounding them out, get a little exercise in, build those muscles, get a
Nice.
tiny bit of calcium in. But compared to kale, holy cow, yeah, it's so different. It's a 150 to 205 milligrams of calcium. What does it say per 100 grams?
Yeah,
Goodness, I'm not good at measuring, but that's a small amount, right?
it
Of
is.
kale.
Yeah.
So I guess maybe I can make some kale pesto versus basil pesto, and I can get more calcium in my diet. Well,
Yeah.
thank you so much, Nurse Practitioner Deidre. Did we cover everything when it comes to calcium, do you think?
I really think that we did. We talked about foods, we talked about, maybe splitting dosing. And then one, final kind of thought to things is just to remember, calcium doesn't clog the arteries. It's the dysfunction that's happening in the
Okay.
body. So if your body's inflamed, insulin resistant, you're deficient in key nutrients, calcium can go the wrong way. It can go into the wrong place where it should be going into the bone, it can go into the vascular. So when your metabolism's balanced, calcium becomes one of the greatest tools for longevity, right? Because we need it for heart, we need it for bone. So
Fantastic. Thank you so much. NP Deidre, make sure to subscribe to her YouTube channel, youtube.com/the @NP Deidre. Also go to her website, aspirewih.com for more information on her services. I know that she does have teleservices across the US as well, if you're interested. But also make sure you like this video, subscribe to our channel, The Way to My Heart, and have a great week, everybody.
talk to you soon.